Hi everyone, welcome back to my channel. I hope you all are doing well. In today's video, let us solve practice questions for CPC exam from CPT Anesthesia section. Before starting, don't forget to hit the like button, share this video and subscribe to my channel. This is the first question. Let us check the codes first. In option A, the code is 01402. 01402 is for anesthesia for open or surgical arthroscopic procedures on knee joint, total knee arthroplasty. Check the code 01382. It is for anesthesia for diagnostic arthroscopic procedures of knee joint. Option C 01400 is for anesthesia for open or surgical arthroscopic procedures on knee joint, not otherwise specified. And option D 01232 is for anesthesia for open procedures involving upper 2/3 of femur amputation. Now let us read the question. An anesthesiologist administers general anesthesia for a total knee arthroplasty. So here they have mentioned total knee arthroplasty. What CPT code should be reported for this service? So which among these four codes is correct? The correct answer is option A 01402 because it represents total knee arthroplasty. Option B 01382 is wrong because it is for anesthesia for diagnostic arthroscopic procedures of knee joint. That is not mentioned in the question. So we'll eliminate option B, and option C 01400 is wrong because it is for open or surgical arthroscopic procedures on knee joint, not otherwise specified. But in the question they have mentioned total knee arthroplasty. Therefore, we are coding 01402. Option D 01232 is wrong because it is for anesthesia for open procedures involving upper 2/3 of femur amputation. In the question, amputation is not given. Therefore, option D is also wrong. Let us move on to the next question. A patient was placed under general anesthesia to have a simple incision and removal of a foreign body from the subcutaneous tissue. This procedure usually requires local anesthesia. Due to unusual circumstances, it required general anesthesia. What modifier would describe this situation? Modifier 47, option B 22, option C 23 and option D modifier P6. Modifier 47 is for anesthesia by surgeon. Modifier 22 is for increased procedural services. Option C is for unusual anesthesia. And option D P6 is for a declared brain dead patient whose organs are being removed for donor purposes. So which among these four modifiers is correct? If you choose option C, then you're right because modifier 23 is for unusual anesthesia. If you check Appendix A, modifier 23, you can find occasionally a procedure which requires either no anesthesia or local anesthesia because of unusual circumstances must be done under general anesthesia. So this description is matching with the question. Therefore, the right answer is option C. Next question. Let us check the options first. Check option A 00560. 00560 is for anesthesia for procedures on heart, pericardial sac and great vessels of chest without pump oxygenator. And option B 00562 is for anesthesia for procedures on heart, pericardial sac and great vessels of chest with pump oxygenator age 1 year or older for all non-coronary bypass procedures or for reoperation for coronary bypass more than 1 month after original operation. Option C 00566 is for anesthesia for direct coronary artery bypass grafting without pump oxygenator, and 00567 is for anesthesia for direct coronary artery bypass grafting with pump oxygenator. Let us read the question. A patient undergoes anesthesia for open heart surgery involving a coronary artery bypass graft CABG with cardiopulmonary bypass. What is the appropriate CPT code? But option A 00560 is for anesthesia for procedures on heart, pericardial sac and great vessels of chest without pump oxygenator. This option is wrong because the code 00560 applies to anesthesia for intracardiac procedures not involving CA-BG. Therefore, we'll eliminate option A, and option B 00562 is also for anesthesia for procedures on heart, pericardial sac and great vessels of chest with pump oxygenator. That is also wrong. And option C 00566 is for anesthesia for direct coronary artery bypass grafting without pump oxygenator. That is exactly matching with the question. In the question they have given involving a coronary artery bypass graft. Therefore, the right answer is option C. Option D is also wrong because it is for with pump oxygenator. In the question, pump oxygenator is not mentioned. Therefore, we cannot code it. Eliminate option D. Next question. Code 00632 indicates that a provider administered anesthesia for which type of procedure in the lumbar region? Option A, lumbar sympathectomy. Option B, chemonucleolysis. Option C, diagnostic or therapeutic lumbar puncture. Option D, not specified. So they're asking, what does the code 00632 indicate? Check the code 00632. It is for anesthesia for procedures in lumbar region, lumbar sympathectomy. Therefore, without thinking much, we'll choose option A. Next question. Why should the add-on code 99100 for qualifying circumstances not be reported with the following codes 00326, 00561, 00834 and 00836? So they're asking why 99100 should not be reported with these four codes 00326, 00561, 00834 and 00836. Check all these codes. The code 00326 is for anesthesia for all procedures on the larynx and trachea in children younger than 1 year of age. Below that, read the parenthetical note. You can also highlight it in your CPT manual. They have given do not report 00326 in conjunction with 99100. Check the next code 00561. 00561 is for anesthesia for procedures on heart, pericardial sac and great vessels of chest with pump oxygenator younger than 1 year of age, and also below that they have given do not report 00561 in conjunction with 99100. Whenever you see parenthetical notes like this, please highlight them. Check next code 00834. 00834 is for anesthesia for hernia repairs in the lower abdomen not otherwise specified younger than 1 year of age, and also below that they have given do not report 00834 in conjunction with 99100. Check the next code 00836. It is for anesthesia for hernia repairs in the lower abdomen, that is for infants younger than 37 weeks gestational age at birth and younger than 50 weeks gestational age at the time of surgery. Below that there is a parenthetical note, do not report 00836 in conjunction with 99100. So all these four codes should not be reported with 99100. Why is it? Because the code 99100 is used to report the age of the patient as younger than 1 or older than 70 years. But in these four codes, the age of the child as younger than 1 year is part of the code. Therefore, it does not require the add-on code. The add-on code 99100 will be unnecessary for correct reporting. Therefore, the right answer is option D. So that's it for today. Thanks for watching. Best of luck to all of you preparing for the CPC exam. I will see you in the next video.